Is trichotillomania hereditary? If you or someone you know is struggling with the compulsive urge to pull out hair, you might be wondering if trichotillomania, or hair-pulling disorder, has a hereditary component. Let's explore this together to understand the role of genetics and other factors. Trichotillomania is a psychiatric condition characterized by the repetitive removal of body hair, often accompanied by significant distress and functional impairment. To determine if it's hereditary, scientists have conducted various studies, particularly focusing on genetic and family factors. One key piece of evidence comes from research on the SLTC1 gene. Studies have shown that mutations in this gene are associated with trichotillomania. For instance, a study involving 40 families with at least one member having trichotillomania found that the SLTC1 gene was mutated in family members with the condition but not in those without it. However, it's important to note that these genetic mutations only account for a small percentage of trichotillomania cases, about 5%. This suggests that while genetics play a role, they are not the sole cause. Other genes and environmental factors also contribute to the development of the disorder. Family and twin studies have further supported the idea that trichotillomania has a heritable link. These studies have found a higher incidence of trichotillomania in families where one or more members already have the condition. For example, if you have a family member with trichotillomania, you might be more susceptible to developing it yourself. In addition to genetics, environmental and biological factors are also significant. People with high levels of stress and tension are more prone to hair pulling as a way to cope with uncomfortable feelings. Brain scans have shown differences in brain development and structure in individuals with trichotillomania compared to those without the disorder. So, is trichotillomania hereditary? Yes, it can be, but it's not the only factor. Genetics do play a role, but the condition is also influenced by other genes, environmental factors, and biological risk factors. Understanding these components can help in developing better treatment options and improving diagnosis. Treatment for trichotillomania often involves cognitive behavioral therapies, such as habit reversal therapy, HRT, combined with stimulus control. This approach helps individuals identify triggers, develop alternative behaviors, and reduce environmental triggers that lead to hair pulling. In summary, while trichotillomania does have a hereditary component, it is just one part of a more complex picture that includes multiple genetic and environmental factors. Understanding this complexity can lead to more effective treatments and better support for those affected.